Radiesse Voice is an injectable implant containing synthetic calcium hydroxyapatite (CaHA) microspheres, which have a diameter range of 25 microns to 45 microns suspended in a clear aqueous gel carrier and is injectable through a 25-gauge needle. Upon injection, the product acts as an instant bulking agent, resulting in an immediate correction. Macrophages dissolve the gel carrier, and fibroblasts form new natural collagen for volume and maintains medialized vocal cords. The carrier gel disappears in 2 to 3 months. As the carrier gel is resorbed, new collagen is formed around the calcium hydroxyapatite spheres. After injection, the new collagen forms a scaffold that anchors the CaHA microspheres. Since Radiesse Voice actively stimulates the production of natural collagen, the effect is longer lasting. The result of Radiesse Voice lasts 1 year or longer in many patients. The CaHA particles gradually dissolve over a period of years and become calcium and phosphate ions. The calcium and phosphate ions are excreted through normal pathways. Connect the transoral needle to the syringe containing the injectable implant. While holding the hub of the needle and observing the hole on the side of the hub, rotate the syringe until the green dot on the syringe is visible through the hole. The needle is malleable. Bend the needle at a desired location by the desired amount to move the syringe and hand out of the field of view. Purge the needle. Note that the dead volume of the needle is approximately 0.18 milliliters. Using either microscopic observation or telescopic observation, advance the needle through the laryngoscope. The ideal first injection site is at the level of the vocal process, lateral to or in the thyroarytenoid muscle at a depth of 5 to 7 millimeters. Select the location for the injection and insert the needle until the 5 millimeter depth marker just disappears from view. Start the injection while observing the infraglottic tissue where the injection will first be visible. Continue to inject under telescopic or microscopic visualization until the desired augmentation has been achieved. Over-inject by approximately 15 to 20%. Repeat additional unilateral and/or contralateral injections as needed to obtain the desired result. Anesthetize the superficial tissue of the neck at the planned injection site with 1 to 2 milliliters 1% lidocaine with epinephrine. The injection should allow for anesthesia of the skin, subcutaneous tissues, and preepiglottic space deep to the thyroid notch. After anesthetizing the nasal cavity, the transnasal endoscope is placed to observe the endolarynx. The needle is inserted through the neck at the thyroid notch at approximately a 45-degree angle. The needle will enter the airway at the level of the petiole of the epiglottis. Instruct the patient to phonate and slowly drip 1 to 3 milliliters of 4% lidocaine onto the vocal folds as the patient continues to phonate. The patient may cough initially, but this will resolve as the lidocaine takes effect. Repeat this laryngeal gargle procedure a total of up to 3 times with a brief pause of approximately 30 seconds in between each step. Take care not to exceed the maximum dose of lidocaine to avoid toxicity. Once the patient appears to have minimal reaction to the dripped lidocaine, the needle can be removed. Wait approximately 2 to 3 minutes. Connect the thyrohyoid needle to the syringe containing injectable implant and insert the needle using the same approach described earlier until its tip is visible in the airway. Ensure that the needle enters the airway only a few millimeters superior to the anterior commissure for ideal access to the entire length of the vocal fold. Orient the syringe and needle so the selected injection site can be reached and advance the needle to the injection site. Observe the insertion depth of the needle and insert the needle to the desired depth. Inject the desired amount of implant based on endoscopic visualization and retract the needle to a holding position in the airway. Instruct the patient to phonate while observing the vocal folds. Repeat additional unilateral and/or contralateral injections as needed to obtain the desired result. Remove the needle completely and instruct the patient to cough and phonate. Document the final result with video stroboscopy.